So in today's lecture, I'll be discussing stroke. What is a stroke? What are the signs and symptoms of stroke? How do you make a diagnosis? And how do you prevent it? This information might spill over into the next lecture, so be patient. So the first thing you want to know about stroke is that it occurs in the brain. What happens is, say you have blood flowing through the brain, and then all of a sudden it's blocked. Can't flow any farther. This part of the brain tissue dies. So again, a stroke is when part of the brain, some cells in the brain die due to decreased blood being supplied to that area of the brain. So there's two general types of stroke that you should be aware of, and we'll emphasize this over and over again, but there's ischemic stroke and hemorrhagic stroke. So ischemic stroke, well, let's take a look at our arteries to see what happens in both situations. So for ischemic stroke, what happens is, for example, you have blood flowing through, but then for some reason can't flow any farther. It's blocked. If there's a blockage here, then everything up here dies, undergoes necrosis. And you have, for hemorrhagic stroke, so again, blocked artery. For blocked artery, so let's take a look at what happens in our vessel again. In our vessel, instead of blockage, there's going to be a rupture. It's going to be an opening. So blood's going to flow out, spill out into the cavities, subarachnoid space, for example, intracerebral space, and these cells up here, again, will not be getting any blood, so they'll be dying. In addition, you'll have all this blood outside in the cavities that can increase pressure of the brain, cause irritation. So hemorrhagic stroke is rupture, due to rupture of blood vessel. So, as you can tell, stroke is classified based on the mechanisms, which we'll look at in depth in the pathogenesis lectures. So, ischemic stroke will account for about 80% of the strokes you'll see in the clinic or whatever healthcare setting you work in, and hemorrhagic stroke is about 20% of all strokes. And what effect can the stroke have in the long term on a patient? Well, maybe no effect. Maybe it can cause disability. Maybe it could even cause death. So in fact, stroke is one of the leading causes of disability and death in the United States. So now that you know kind of what stroke is, we're going to go more in depth into what the signs and symptoms are, and then eventually how you can diagnose it and prevent it. So first, the major thing you want to know, first thing you want to know about stroke is the acronym FAST. You want to know this, your patients should know this. Anyone who is at potential risk of having a stroke should know this and teach this to their family and friends. So FAST stands for face, arms, speech, and time. So face. So first thing you may notice about stroke is drooping. So if you notice drooping, ask a patient to smile. If they can't smile, it could be a symptom of stroke. Arms, weakness. Weakness in the arms could be a symptom of stroke. Ask the patient to raise both his or her arms. It could be unilateral, it could be bilateral. If they can't raise the arms, it could be a symptom of stroke. Speech. Speech could be slurred, garbled, difficult. Ask the patient to say a simple sentence like, "Is the sky blue?" If the sky is blue, if they can't say that simple sentence, maybe they're experiencing a stroke. TIME stands for time to call 911. You want immediate response to a stroke, because the longer the stroke lasts, the longer blood flow can't get to neurons, the more permanent brain damage a person can suffer from. So, time. Tell your patients time means time to call 911. For you, time also means know the time course of the stroke. The time course is the most important, is one of three main things that you'll use to diagnose the stroke. Diagnosing the stroke is important for both understanding the outcomes and understanding what treatment options are available, which we'll discuss later. So again, teach your patients FAST. Face, arm, speech, time. FAST. That's stroke. So now that you have a little bit intro to the signs and symptoms of stroke, we're going to focus on first a general overview. say a patient comes into your healthcare setting with stroke, what are the first two things that should go through your mind? One, the first thing, is it ischemic? So is it due to a blocked artery? Or is it hemorrhagic? Due to a ruptured artery. Both are treated very differently, have very different outcomes. So that's the first thing you want to figure out when you're dealing with a stroke patient. Or is it even a stroke? That's also something you have to consider. It could be another symptom like seizure or syncope, which is passing out. Second thing you want to consider, and always have this in the back of your mind, is there going to be permanent brain damage? And what kind of damage will it be? So just keep these two concepts in the back of your head while you're bringing in a patient. And so what's the first thing that happens when you actually bring in the patient? You're going to look at their vitals. And these are the first signs and symptoms that you can use to test whether it's a stroke. So the first vital you're going to look at is blood pressure. If you see hypertension, severe hypertension, it could be a stroke. Not because stroke causes hypertension, but because hypertension is a very big risk factor for stroke. And hypertension can eliminate a lot of other diseases from our differential diagnosis. Another vital you can look for is respiratory rate, hypoventilation. If you see hypoventilation, it could be a stroke. Decreased breathing. Third vital you're going to look for is fever. So if there's a fever, again, could also be a stroke. So these three vitals point to, and so once you check these three vitals, the next sign or symptom you're going to look for is your CT, or first history, sorry. So first you're going to take your history. So you're going to confirm it's a stroke, get the time course, get the onset time, and then we're going to try and determine the etiology or cause and the subtype of the stroke. And after the history, you're going to take a CT. So, and history also incorporates like risk factors. So if you know what risk factors the patient was engaged in, then it could point to some type of, indicate what type of stroke it was. So the next sign or symptom is going to be, you're going to observe that through a CT. So you can take a non-contrast CT of the head. You want this to be, you can also do an MRI, but CT is more inexpensive, more accessible. You want this as fast as possible so you can know what's going on in the patient's head. So, and after this, you might want to consider taking a lumbar puncture. So looking in the cerebrospinal fluid for blood, if there is a high concentration of blood, could be indicative of hemorrhagic stroke, so ruptured blood vessel in the brain. And we'll go more in depth into this when we talk about the mechanisms. And in addition to this, what these all tell you, these vitals, they will allow you to make your first decision. And we'll go more into this decision later, but the first one is whether to use thrombolytic therapy. Thrombolytic therapy refers to giving the patient drugs that can clear a thrombus or a blockage. So if you know there's a thrombus, based on the history, CT, and time course of the stroke, that history, and you know whether it's thrombus or embolus or hemorrhagic, then you can decide whether to use thrombolytic therapy. So that's just a general overview of stroke, and we're going to go more in detail into the diagnosis now. So the diagnosis is going to be based on, first, the differential. Is it a stroke? So some things, it could be some other things, so I'll list the differential here. Similar symptoms could present with seizures, syncope, so passing out, migraines. Hypoglycemia could cause similar symptoms. Low blood sugar can make you pass out, for example, or have decreased brain function. Drug overdose, random effects, insulin overdose, or too little. This is our differential diagnosis. Let's see, recent trauma could also, recent trauma could cause similar symptoms to stroke. And finally, the last one is just hysteria. So again, this is our differential diagnosis, and using your history, the image, your history and the image basically, and the time course of the stroke. So history, CT, time course, so onset, admission time, symptoms. These could point to whether it's a stroke or not, and then also what type of stroke it is. And we'll continue more into diagnosing stroke in the next lecture.